Hello, I hope you are able to hear me. Well, thank you very much for joining my session. Well, I know it's one of those Fridays. I just came back from India. We have a lot of things going on. Diwali is coming this weekend, and happy Diwali, by the way, guys, much in advance. Thank you very much again for listening my startup show every Friday. I try to do it every Friday at 12 noon. So today we are going to talk about very, very interesting opportunity. And as you all know, healthcare is one of my favorite subject where I talk about the healthcare problems, issues, challenges in medical practices, especially in non-clinical revenue cycle management, and how we can convert those challenges into an opportunity for startups. So that is our goal. And today I'm going to talk about an amazing opportunity which has recently come for healthcare startups or people who wants to talk about or who wants to continuously innovate into healthcare field. I'm going to show you some documents, but before that, let me give you a little brief where this opportunity came from. So as I said in the very beginning of my sessions, those who have attended my previous sessions, I always talk about is problem prognosis. How do we identify? How do we identify where is the opportunity for startups or to solve a problem? A lot of people come up with a lot of ideas. People come up with different, solutions based on their own gut feeling sometimes or based on what they see. The actual prognosis of the problem should be based on where the problem comes from. If we can find out the genesis of the problem by interviewing people who are facing that problem. So, one of a very famous medical group, it's called Medical Group Management Association, one of the biggest MGMA. It's one of the biggest organization. It's a not for profit, and their job is basically to do all those surveys and come up with different type of reports and explain to medical office managers and doctors that hey, you guys are going to face this issue probably next year, or these are the public policy documents which are going to impact or affect your medical practice management. And when they come up with those documents time to time, uh, they expect these medical practices to pay attention to those documents and then find solutions in order to help their not only the physicians but also their patients. Um, so it says the backstage is open. I don't know. So I hope you can hear me. Can you hear me? I hope you can hear me. Um, August, it can be heard by the audience while live. Okay. So that was the main thing I was talking about. So one of those reports came up recently. It is called Annual Regulatory Burden Survey. What that means? So it simply means that MGMA has gone out and surveyed hundreds and hundreds of medical practices about their burden level based on few few of their features or few of the uh, some of those things which they have been working out, uh, like some of the fundamentals of the practices and some of those regulatory issues which these medical practices have been facing. One of them was uh, one of them was prior authorization, and that carries the highest level of burden. What that means is most of the medical practices in today's time, they have seen an increase in utilization of prior authorization across both commercial payers and Medicare Advantage plans. They are struggling to ensure whether patients continue to maintain access to medical necessary care. So prior authorization process is very simple. It's basically insurance company is asking medical office to take the permission before seeing a patient. Not only the complex procedure, but nowadays they are saying even the routine procedures they have been asking to take prior authorization. 89% of practices they have had to hire an additional staff or redistribute the current staffing resources to process prior authorization due to the increased number of requests. Now, this is a huge problem. This is one of the biggest issue or the pain point, the problem what we call it for the startups where medical practices have been talking about. 82% of the medical practices say that it is extremely burdensome process. Now, see if I can show you this report because I really wanted to show you this document. And if you can, oh, you know what? I can simply share my screen. Simply share this screen. How about this? I hope you can see it. Okay, perfect. So if you see this screen, this is the report I was talking about. So this report clearly says that 82% of people are talking about prior authorization as one of the biggest issues. So this is the problem, real data I'm getting for you where you can find opportunities to innovate. Second issue, which is another issue, which is again a very huge issue, is surprise billing and good faith estimate requirement. So what happens initially, those patients who are out of network patient requires a good faith estimate before even the doctors see them. So if you go to a hospital, if you go to a medical practice which is out of network and you need to see a doctor has to give you some kind of good faith estimate if he is out of network. Let's say $200 to see you. It cannot be earlier, before last year. This used to be whatever the insurance they allow. So let's say if they file $300 for your charge for today's visit to the insurance company comes back and say, hey, you have an out of network deductible of $5,000. Then you are supposed to pay the entire $300. Now, they would give you a good faith estimate in advance and they will say, okay, for today's visit, the maximum we are going to bill you $200. So even if your insurance company they don't pay you, you are going to receive the maximum bill of $200. Now, think about it. There are thousands of procedures, thousands of doctors. Every doctor has their own way of calculating GFE, which is good faith estimate. What if our innovators or startup enthusiasts or somebody come up with some kind of solution to solve this problem of coming up with a standardization in good faith estimate? That's another opportunity I'm talking about. So again, if you have seen my previous startup sessions, I have talked about public policy and how a prognosis of a problem provides you an opportunity to innovate. Here is a way you can see how these are the problems, and these problems are providing an opportunity for different startups to innovate. There are thousands of startups, there are thousands of solutions which are addressing MIPS and APMs, medical quality programs, because this program is old, but still 65% doctors' offices, they are still finding this as extremely, extremely burdensome and challenging. Number fourth is audit and appeals. That is, again, this is a highly clerical job at a doctor's side. So a lot of these medical offices, they have to hire more people, or these billing companies like ourselves, we have to hire more people or hire specialized people who can find who can do the auditing work, who can do the appeal, who can respond to the audits, who can send appeals for the claims to get paid. That's another area which has got a lot of opportunities, in particular this area for healthcare innovation partners or healthcare innovative startups. Another important thing which comes out to be Medicare Advantage chart audits. Now, what happens when the Medicare sends you the audits, or Medicare Advantage plan, where you are capitated or you're taking a high risk to see the patient, you are exposed to chart audits. So you would always need people who, or certified coders, who can respond to Medicare Advantage chart audits. And again, this is an opportunity where people can develop AI based functions, they can develop AI based coding solutions. Uh, People can come up with different idea to solve these problems. So in this show, all I'm doing is sharing the problems, the pain points these medical practices has, and they are going to increase in year 2023. Like, one of the most important thing I want to talk about in today's show, which is coming up soon, and I'm going to talk about it, is the reduction, payment reduction for 4.5%. 4.5% from different Medicare programs. And one of the program which is extremely, extremely important, and uh, Medicare is asking, is is basically they are saying that across the board there would be 4.5% reduction to Medicare conversion factor. So what that means is simply all Medicare patients, if your practices see Medicare patients, there would be across the board 2.5% reduction in your current Medicare fee schedules, and another 2%, no, 4.5% reduction in your Medicare conversion factor, and then 4% pay go sequestrian. Pay go sequestrian is the amount which you got paid during the COVID times. So most medical practices, if you see these, they are going to see 4.5% reduction to Medicare conversion factor and 4% pay go sequestration, which means total 8.5% projected payment cuts. More reasons for medical practices to innovate, more reasons for our healthcare startups to come up with a solution, which are startup, which can create solutions for medical practices. There are 58%. So when we talk about this, there are 58% people are considering limited the number of new Medicare patients. So if the medical practices will not see enough Medicare patients, who is going to see it? If you remember Medicaid, it used to be the same situation. A lot of Medicaid patients, when Medicaid cut down their payments, a lot of these doctors stopped taking Medicaid patients. Now think about it, the same thing is going to happen for Medicare patients. 58% people, doctors, they say they are considering reducing the number of clinical staff because they just simply can't afford it. 29% are considering closing satellite locations. So if people used to offer satellite locations for their medical practices, they're planning to even close them. So again, point I'm trying to make here is, if startups or healthcare innovators don't innovate, all of these medical practices are going to bleed with this 8.5% projected payment cuts in year 2023. So all of these provide a lot of new reasons for people to innovate. Now, I think with this, I'm going to end this session because already 15 minutes, and I think most people start losing their attention if they don't find the enough content about what I'm talking about, but we talked about two or three important things today. I'm going to summarize it for you. Year 2023, Medicare provides 8.5% reduction in their payment, projected payment cut. So all of the Medicare patients and Medicare medical practices who see Medicare practices, they need to innovate, they need to find better ways to engage their patients or make money somewhere else. Provides an opportunity to healthcare startups. You need to figure out the solutions based on these reports, based on this problem prognosis, based on these pain points. Figure out, come up with some startup new solutions or innovations which can help physicians or medical practices make, either reduce cost or incentivize, or make some incentives or make some money in somewhere else in the patient care process. So with these two good ideas, I'm going to take a leave. Have a happy Friday. I'm going to talk to you next Friday. Until then, happy Diwali and have a great week ahead. Have a fantastic weekend, friends.